Today's session is going to be focusing on Medicaid policy flexibilities to support CMC and their families during the pandemic. Our faculty presenter is Meg Como. Meg Como is a senior project director at the Center for Innovation in Social Work and Health. She's a nationally recognized expert on the impact of Medicaid and federal healthcare reform for children with special healthcare needs. And she brings more than 15 years of healthcare delivery and financing experience to her role as principal investigator for the Collaborative Improvement and Innovation Network to advance care for children with medical complexity, and as principal investigator of the Catalyst Center, a project focused on improving insurance coverage and financing of care for children and youth with special healthcare needs. With that, Meg, I'm going to turn it over to you.
Thanks so much, Amy. I appreciate that. Let's just do a quick audio check. Can you hear me okay? Great, great. Okay, if we could switch slides. So I'm happy to report that I have no money, so I have nothing to disclose. Let's go ahead and switch to the next slide, please. Our learning objectives today include a description of what the Medicaid policy flexibilities are available under a public health emergency. They're being able to explain their relevance to kids with medical complexity who are enrolled in Medicaid and CHIP, understanding the various authorities available to states in a public health emergency and some examples of what's available under them, and identifying resources to use and researching which authorities are in use for you locally. I want to just level set a little bit with a couple of cautions. I probably will not be able to answer specific questions about Medicaid and CHIP flexibilities in your specific state. It's really complicated. Every state has things going on, but I will be able to provide resources to you in learning more about what's available locally. And I'd be more than happy to follow up with you individually if you have questions based on what you learn. I want to also be clear that today I'm not wearing my CMC CoIIN hat, I'm wearing my Catalyst Center hat, so a little different role for me today. I am going to switch a little bit over the course of the presentation between focusing on Medicaid specifically and then Medicaid and CHIP jointly. I'll try to be clear when I'm doing that, but if it gets confusing, please stop me and I'll clarify. And this is going to be just a high-level overview of a complex topic given the time constraints. But again, the Catalyst Center and its team is available to you all to speak individually at any time around technical assistance in understanding some of the more nuanced pieces of this. Next slide, please. So a lot of the following on this slide is going to be familiar to you, but it does help lay the groundwork for understanding the context in which Medicaid and CHIP flexibilities operate in a public health emergency. Medicaid's a public insurance program that provides health coverage to low-income families and individuals, including children, parents, pregnant women, seniors, and people with disabilities, which also includes children with disabilities. It's funded jointly between the states and the federal government. Federal laws and regulations provide a foundation for how state Medicaid programs work. But upon that foundation, states have a lot of choice in who they cover, what they cover, and how they provide benefits. According to CMS in November of 2020, approximately 49% of all Medicaid and CHIP enrollees were children. Data from the literature typically identifies children with medical complexity as approximately 6% of that total percent of children who are enrolled in Medicaid alone. So when we're talking about children with medical complexity, we're talking about a much smaller number in the whole child population covered by Medicaid, but we're talking about a lot higher utilization and by extension costs. And so Medicaid and CHIP is important to children with medical complexity because of the robust benefit package it offers and the zero to very, very low cost sharing. It's important to their families as a bulwark against family financial hardship and being able to get access to the services that their children need. It's important to providers and it's important to payers as a result. So all the stakeholders have a stake in Medicaid. Let's go ahead and switch to the next slide, please. So in terms of flexibilities for state Medicaid and CHIP programs, ordinarily under sort of typical circumstances, states operate their Medicaid and CHIP programs according to a state plan and federally approved waiver programs. So what's a waiver program? A waiver program allows states with permission from the Centers for Medicare and Medicaid Services to set aside some of the federal regulations I just mentioned in order to target specific services and supports to specific populations of enrollees. Every state has waiver programs that impact children with disabilities and other health needs. Some are specific to children with medical complexity. The number of waivers and the operational details under those waivers vary between states. CMS has a web page available to you with links to each state's waiver program's application, and then CMS's approval letter, if it was approved, in order for you to learn more. Amy and I are going to make sure that you get a link to all of the web pages that I reference in today's presentation following today's session. State programs are integral, State programs are integral to the system of services and supports for children with medical complexity and have to be ready to adapt and respond to the current challenges faced by children, families, providers, and other stakeholders. So in a typical context, kids with medical complexity have needs that states need to respond to and adapt to in order for the system of services and supports to work for them. Medicaid waivers are one way to do that. In a public health emergency, however, things become even more critical. Next slide, please. So there are a variety of different flexibilities available for states in terms of a public health emergency. In a disaster or another emergency situation like a pandemic, the Centers for Medicare and Medicaid Services, CMS, can offer states and territories a number of flexible options that temporarily modify or waive certain federal requirements in order for them to meet the emergency needs of Medicaid and CHIP beneficiaries. There are different authorities that are available to states, and those different authorities can be used to meet different needs. We're going to focus on 3 of those authorities today, 2 that touch specifically on Medicaid and 1 that touches specifically on CHIP. States have to apply to CMS and get approval before implementing any of these authorities and the menu of options that are available to them underneath those authorities. So all states have at least one of the 1135 authorities that I'm going to talk about and at least one Appendix K authority that I'm going to talk about in just a minute. Let's go ahead and switch to the next slide. So let's start by talking a little bit about Section 1135 waiver flexibilities. The Social Security Act authorizes Medicare, Medicaid, CHIP, and other HHS social service programs. Section 1135 of the Social Security Act authorizes the Secretary of HHS to temporarily waive or modify certain federal requirements under these programs. The goal is to be able to continue to meet the healthcare needs of enrollees in the states in the context of a disaster or a public health emergency. Both a declaration of a national emergency or disaster by the president, as well as a public health emergency determination by the HHS secretary are required in order for a state to apply for 1135 waiver. Currently, this authority is in effect until July 19th, 2021. It can be extended if the secretary makes the decision to extend it. And it's my understanding from the folks that I have the opportunity to talk to regularly that the expectation is that the public health emergency is going to be extended until the end of this calendar year. Next slide, please. So let's talk a little bit about some examples of the menu of options that are available to states under 1135. One of the examples is provider enrollment and participation rules that can be modified. An example of this is removing limitations on physicians or other clinicians practicing in states that they're not licensed in. Now, let me be clear, nobody's going to let me say, oh, I'm a rheumatologist today and start practicing as a rheumatologist. There needs to be equivalent licensing in another state available for that provider. But the ordinary rules that really are constraining around who's licensed where and who can practice where get modified a little bit, they get expanded a little bit in order to expand the workforce that's available to serve populations in the context of a public health emergency. Appeals and fair hearings are another category. For example, speeding up the process for managed care enrollees to proceed to a state fair hearing and extending the time period for requesting a state fair hearing on managed care and fee-for-service appeals. The rationale for this is twofold. One, in terms of speeding up the process for going to a fair hearing, if an enrollee has been denied for a specific service, there's a whole process that typically has to happen before you can get to a fair hearing. And there are time frames, associated with those.
On my way to the hospital.
Can I ask you all to just thank you, just take a look at and make sure that you're muted. So there are constraints around and timeframes associated with moving through the process of getting to a fair hearing. Under 1135, states can collapse that a little bit and make it faster, because the appreciation is that if an enrollee needs a certain service, then they probably don't have time to waste in the context of an emergency and getting to that service. So you make those decisions faster around appeals. Extending the time period for requesting a fair hearing assumes that folks have a lot going on in a public health emergency, and they might not be able to get to requesting a fair hearing in the typical time frame that they're required to before they're no longer eligible for a fair hearing. So those are flexibilities that can help managed care enrollees and folks who have fee-for-service appeals. Reporting and oversight requirements are also an example of one of the options that's available under 1135. For example, suspending the requirements that a registered nurse supervise aides employed by home health or hospice agencies. The part of the rationale for this is that the assumption that oftentimes the nursing workforce will be detailed to or otherwise, absorbed by the acute care service delivery system, and might not be available to supervise those aides in home health or hospice agencies. And so in order for people to not miss out on those services, aides can continue to practice without necessarily being supervised in the same way that they would by a registered nurse in the context of, sort of typical time. To learn what 1135 options your state has chosen, there's a link here in the slide deck. And we'll also make sure, Amy and I will make sure that this is available to you as an active link following today's presentation. Next slide, please. So another option, and again, I mentioned earlier that I was going to concentrate on two that are specific to Medicaid. 1135 is specific to Medicaid. Section 1915C, Home and Community-Based Service Waiver Appendix K, is also specific to Medicaid. Section 1915C of the Social Security Act allows states and territories to waive certain federal requirements under Medicaid in order to provide specific targeted services to specific targeted beneficiaries who have disabilities. The goal of a waiver program is to provide additional services and supports to folks to keep them at home and in their communities, as opposed to in an institutional setting. Appendix K is a temporary standalone addition to an existing 1915C waiver that states can request in the event of a disaster or other emergency in order to respond to those unique needs of home and community-based service waiver enrollees. Currently, Authority 1915C Appendix K is in effect until January 19th, 2022, with a CMS extension if a state has asked CMS for an extension. If a state has not asked for an extension of their Appendix K, it expired earlier this year. So that's going to be an important thing that you're going to want to think about when you go to learn more about what's happening in your individual state, whether it's still in effect or whether it's expired and no longer applicable. Next slide, please. A separate Appendix K application has to be filed for each existing waiver that a state wants to modify. Here again is a link that you can go to on medicaid.gov to learn about what your state has chosen. Under Appendix K, what that sort of list of options have been chosen for each individual waiver that your state has. Some states have, a couple, some states have a whole boatload. So it depends on where you are. Again, this is a element of the variability that happens between states, and how important it is to understand what's actually going on with you in sort of your local environment. Next slide, please. So here are some examples of changes or modifications that are permitted under Appendix K. And again, these are not required. States can request these, and they're just examples. So in terms of eligibility criteria, it allows a waiver enrollees to maintain eligibility without receiving services. Typically, you have to be receiving services in order to remain on the waiver, but the understanding is that those services might not be available in a public health emergency. And so it keeps people from getting thrown off the waiver if they're not able to receive those services, not because they don't need them anymore, but because they're just not available. Covered service changes are really important. And this is something that we've heard a lot of folks who are engaged around the care of kids with medical complexity, but also kids with disabilities and adults with disabilities as being something that has been really interesting and helpful. Modifying service scope and coverage, increasing existing service limits or requirements around amount or duration or prior authorization, adding the option for home delivered meals, adding medical supplies, adding medication pre-fills, which has been helpful to many, many families, equipment or assistive technology. Another modification that's permitted is around settings. Typically, you have to be receiving home and community-based services in your home or in another community setting that has been approved by CMS. But this sort of expands the array of settings in which home and community-based services can be provided and paid for, such as churches and hotels and shelters, et cetera. It also allows for the provision of services in out-of-state settings where a state has asked for that and CMS has given specific approval around it. It also offers payment for services provided by family caregivers or other legally responsible individuals and a temporary increase in payment rates. Next slide, please. I'm going to talk just briefly about something that's specific to CHIP. States with a separate CHIP program have the option to submit a disaster relief state plan amendment or SPA. Some of the flexibilities that are available to states under this include waiving premiums, cost sharing, changing application and redetermination policies, changing verification requirements. The major rationale for these changes is to keep people from getting thrown off of CHIP and keeping them in their coverage as they need it in the context of a public health emergency and really expanding their opportunities for keeping that coverage. And again, there's a link to learn more about what's going on in your state. Next slide, please. So we have a whole list of resources here. We're going to add a few after today's presentation, including a really nice authority tracker, Medicaid Emergency Authority Tracker that the Kaiser Family Foundation has produced, and also a link to Medicaid's state waiver webpage at medicaid.gov. But this will really help you understand what's going on locally for you and for the families that you serve and care for. And again, the Catalyst Center is always available to you afterwards so that you can learn more about the implications, what other states are doing, et cetera. Next slide, please. So we're going to close out now with some questions and discussion. I believe that Bethlyn Houlihan is going to be moderating the question and discussion piece of our session today, post-didactic, and then we're going to move into our case in just a moment.